Right now, somewhere in the back of your throat, your stomach is quietly making a decision about your brain. With every meal you eat, it decides how much of one particular vitamin actually reaches your bloodstream. And here's the part that should make you sit up. As we move past 60, that quiet little system inside the stomach begins to slow down. And for a great many people, it simply stops letting enough of this one vitamin through. The result can look frightening. Forgetfulness. A foggy, slow-moving mind. Trouble finding words. Tingling in the hands and feet. It can look so much like the early stages of dementia that even good doctors sometimes mistake it for exactly that. But here is the difference that matters more than almost anything I will tell you today. When this vitamin is the real cause and it is caught in time, much of that fog can lift. It is one of the few causes of memory trouble that is genuinely reversible. I am Dr. Robert Lane. For more than 21 years, I have worked in neurology, sitting with people who came into my office terrified that they were losing their minds. And in that time, I have learned something that I wish more families understood. Not every memory problem after 60 is dementia. Some of it is something far simpler, something we can actually measure with a single blood test. So if you have been worried about your own memory or the memory of someone you love, I am asking you to relax your shoulders, take a slow breath, and stay with me for the next few minutes. Because what I am going to explain is honest, it is grounded in real science, and it points to a question you can ask your own doctor as early as this week. The vitamin I am talking about is vitamin B12. And before we go a single step further, I want to be very clear and very honest with you, because you deserve nothing less. I am not going to tell you that vitamin B12 prevents dementia. The science does not say that, and I will not pretend it does. What the research does show is that low B12 is common in older adults, that it is strongly linked to memory and nerve problems, and that when a true deficiency is found and corrected, people often feel sharper and steadier again. That is a very different promise, and it is a true one. So, if you have ever wished someone would give you the real picture instead of a miracle headline, you are in the right place. If you find that this kind of plain, honest explanation is helpful to you, please take one quiet second to like this video and to subscribe to the channel. It genuinely helps me reach more people over 60 who are frightened and looking for steady answers, and it costs you nothing at all. Now, let me tell you about a man who walked into my office certain that his life, as he knew it, was over. I will call him Walter. He was 71 years old, a retired school teacher, and the sharpest man you could imagine for most of his life. But over about a year, his wife told me, he had changed. He was forgetting names of old friends. He left the stove on twice. He felt unsteady on his feet, and he described a strange tingling, like pins and needles in both of his hands. By the time they came to see me, Walter had quietly decided he had Alzheimer's disease, and he had stopped doing the things he loved because he was so afraid. I listened to all of it, and then, before we talked about anything frightening, I ordered some simple blood work. His vitamin B12 level came back very low. We worked with his regular doctor to correct it carefully and properly. Walter did not turn back into a 20-year-old, and I would never promise that to anyone. But over the following months, the tingling eased, his footing improved, and his wife told me he was, in her words, much more himself again. Walter's story is not a magic trick. It is simply what can happen when a real, reversible cause is found instead of being missed. I tell you Walter's story not because every case ends that way, because they do not. Sometimes the memory trouble truly is the beginning of dementia, and a low vitamin level is only a small piece of a larger picture. I would never want to give you false hope. But I have sat with too many families who never thought to ask one simple question and who spent months in fear when the answer was sitting quietly in a vial of blood the whole time. That is the reason I am making this video. Not to promise you a cure, but to make sure you and your family never skip the cheap, simple, hopeful step before you assume the worst. So let us slow down and understand why this one vitamin matters so much to your brain. B12 is not a small player. Your body uses it to do at least two jobs that your nervous system depends on completely. The first job is building and protecting the coating around your nerves. Think of the wiring in your house. Every wire is wrapped in a protective sheath, and that sheath keeps the electrical signal traveling cleanly from one end to the other. Your nerves have a coating very much like that, and B12 helps build and maintain it. When B12 runs low for a long time, that coating can begin to fray, and when the wiring frays, the signals get noisy. That is the tingling in the hands and feet. That is the unsteadiness, and in the brain, that is part of the fog. There is a second piece of this first job that I want you to picture because it makes the danger real. When the protective coating on a nerve frays, the signal does not just travel a little slower, it can travel to the wrong place or arrive scrambled the way a phone call breaks up when the line is bad. You ask your hand to do something, and there is a small delay or a strange sensation that should not be there. Over a long enough time, and with the deficiency left uncorrected, some of that nerve damage can become permanent. That is the single most important reason not to wait. Caught early, much of this can heal. Left for years, some of it may not. Time is genuinely on your side here, but only if you act while the window is open. The second main job that B12 does is just as important. B12 helps your body keep a certain substance in the blood under control, a substance called homocysteine. You do not need to remember that word. Just picture it like this. Imagine a kitchen sink. When everything is working, water flows down the drain and the sink stays clean. But when the drain is partly blocked, the water backs up and pools, and over time that standing water can stain and damage everything around it. B12 is one of the things that keeps that particular drain clear. When B12 is low, this substance can build up, and higher levels of it have been linked in many studies to faster memory decline and to shrinkage in the brain over time. Now, I want to be careful and honest here because this is where a lot of headlines get carried away. Researchers are still working out exactly how much of that is cause and how much is simply a warning sign traveling alongside other problems. Some large reviews have found that simply taking B vitamins did not, on its own, restore brain function in people who were already getting enough. So I am not going to oversell it. The honest summary is this. Low B12 is a red flag worth taking seriously, and it is a flag you can actually do something about. The goal is to find a true deficiency and correct it, not to pour high doses into a body that already has plenty. Now, you might be asking the most reasonable question in the world. Doctor, I eat well, so why on earth would I be low? This is the part that surprises almost everyone, so let me explain it gently. Getting B12 from your food is not as simple as just eating it. Your stomach has to perform a small, clever process to unlock the B12 from your meal and escort it into your bloodstream. It needs enough stomach acid, and it needs a special helper substance that the stomach makes. And here is the heart of the matter. As we age, the stomach very commonly makes less acid and less of that helper. There is even a common condition where the stomach lining thins with age that affects a large share of older adults. When that happens, you can eat all the right foods and still absorb far too little of the B12 inside them. Your plate is full, but the door into your bloodstream is barely open. Let me give you another way to see it. Imagine your favorite food arrives at your front door, beautifully wrapped in a box, but the box is sealed shut, and you have lost the key that opens it. The food is right there, inches away, and yet you cannot get to a single bite of it. That sealed box is what happens to B12 in an aging stomach that no longer makes enough acid or enough of that special helper. The vitamin is on your plate. It is in your stomach. But the key that opens the box is missing, so very little of it actually crosses into your blood. This is why a person can eat a healthy B12-rich diet for years and still, slowly, quietly, run low. It is not about willpower or eating the wrong things. It is about a door that ages along with the rest of us. There is more, and this matters for many of you watching. Certain very common situations make low B12 much more likely. If you follow a strict vegetarian or vegan diet, you are at higher risk because B12 comes mainly from animal foods like meat, fish, eggs, and dairy. If you take a common diabetes medicine called Metformin, it can lower your B12 over time. If you take certain long-term stomach acid medicines, the kind many people take for heartburn and reflux, those can reduce absorption too. And simply being over 60, all on its own, raises your risk. In fact, studies have found that low B12 shows up in a meaningful share of older adults, and the thinning of the stomach lining that drives so much of it is itself common with age. So please hear me clearly. I am not telling you to stop any medication. I would never tell you that, and you should never stop a prescribed medicine on your own. I am telling you that if any of these describe you, this is a wonderful, specific reason to ask your doctor a simple question. And that question is the most useful thing you will take from this entire video. The next time you see your doctor, you can say these words. Could we check my vitamin B12 level? That is it. It is an ordinary blood test, widely available, and it is often done as part of routine blood work anyway. If your memory has been slipping, if you have noticed tingling in your hands or feet, if you feel unusually tired or unsteady, or if you fall into any of those higher risk groups I just described, this is a fair and sensible thing to ask for. A good doctor will not mind the question at all. In fact, most will be glad you asked because catching a deficiency early is so much easier than chasing the damage later. Let me walk you through what usually happens next, so none of it feels mysterious. If the test shows your level is low, your doctor will want to understand why, because the reason guides the fix. For some people, the answer is gentle and simple, a daily supplement or eating more B12-rich foods and fortified foods. For others, especially when the stomach is not absorbing well, swallowing a pill is not enough because the problem was never about how much went into the mouth. It was about how little got through the stomach wall. In those cases, doctors may use a form that bypasses that blocked door entirely, such as an injection or a high dose under the tongue. This is exactly why you do not want to guess and treat yourself. The same low number can have different best answers, and only testing tells you which one is yours. Now let me tell you the common mistakes I see, so you can step around them. The first mistake is assuming that any memory trouble must be dementia and quietly giving up. Please do not do that. Get the simple things checked first. The second mistake is the opposite, rushing to a pharmacy and buying the biggest, strongest B12 pills on the shelf without ever being tested. More is not automatically better, and for some causes, an ordinary pill will not even solve the problem. The third mistake is taking a supplement for a few days, feeling no instant change, and quitting. Nerves heal slowly. If a true deficiency is being corrected, improvement comes over weeks and months, not overnight. And the fourth mistake, and maybe the most important, is never mentioning it to your doctor at all, and trying to manage a medical question entirely on your own. So let me give you the safety part plainly, because honesty is the whole point of this channel. For most healthy people, the small, everyday amount of B12 found in a standard multivitamin or a fortified food is considered very safe, and your body simply passes what it does not need. But before you begin any high-dose supplement, or before you make a real change because you are worried about your memory, please talk with your own doctor first. There are two reasons this matters so much. First, taking B12 on your own can sometimes mask another deficiency that needs its own treatment, which is one more reason testing first is wiser than guessing. Second, your memory symptoms could have a different cause that deserves attention, and you do not want a bottle of vitamins to delay you finding the real answer. Your doctor knows your history, your medicines, and your body. Bring this idea to them and let them guide you safely. And please, never stop or change a prescribed medication on your own. That conversation always belongs with your doctor. Now, here is how to turn all of this into a simple, lasting habit. Because knowing something and acting on it are two very different things. Attach the question to an appointment you already have. You very likely have a routine checkup or blood draw at some point this year. So let that visit be your reminder. Write 4 words on a small card and put it in your wallet or tape it to the refrigerator. Check my B12. When the appointment comes, you hand over the card or you simply ask. You are not adding a new chore to your life. You are attaching one good question to a moment that was already going to happen. And here is a small bonus that stacks neatly on top. While you wait for that appointment, you can gently support your B12 through everyday food with no risk and no prescription needed. B12 is found in fish, eggs, dairy, and meat. And many ordinary foods on your grocery shelf are fortified with it, things like certain breakfast cereals and some plant milks. The fortified kind is especially worth knowing about, because the B12 added to those foods is often easier for an older stomach to absorb than the form locked inside natural foods. So, a fortified breakfast cereal in the morning is a quiet, friendly way to give your body a little more of what it needs while you arrange that simple test. Let me bring this all together for you now. Vitamin B12 does real important work for your nervous system. It helps protect the coating around your nerves, and it helps keep a certain substance in your blood under control, a substance tied in many studies to memory decline. Low B12 is genuinely common after 60, often because the aging stomach absorbs it less well and because of certain diets and common medicines. Its symptoms, the forgetfulness, the fog, the tingling, can look so much like dementia that the real cause is sometimes missed. And when a true deficiency is the cause, and it is caught and corrected in time, much of that trouble can ease. That is why this is one of the most hopeful conversations in all of brain health. So, I am not promising you that a vitamin will prevent dementia, because that is not what the science shows, and I will always tell you the truth. What I am giving you is something better than a false promise. I am giving you a simple, specific, reversible cause that is worth ruling out, and a single sentence you can carry into your next appointment. Could we check my vitamin B12 level? For some of you, that one question may turn out to matter a great deal. If this was helpful to you, and you would like more honest, plain-spoken explanations about your brain, your sleep, and your memory, please subscribe and stay with us here. This channel exists to help you stay clear, steady, and independent well past 60, and I would be honored to walk that road with you. Take good care of yourself, talk with your doctor, and I will see you in the next one. And one important closing note. This video is for general educational and informational purposes only, and it is not medical advice. Always speak with your own qualified healthcare provider before making any changes to your diet, your supplements, or your medications. Your doctor knows your body and your history, so bring this idea to them, ask them to check your level if it is right for you, and let them help you use it safely.